Family Health Case Study by Dimitri, Ugo, and Ashley.
This is the case study on which we based our research in the wiki page.
Human systems model to assess the family's ability to adapt. Cancer is a disease that can be caused by many factors, including environmental factors and family history. Lifestyle behaviors such as smoking, obesity, and excessive alcohol drinking are also factors that can cause cancer. The M family does not have any family history of heritable disease that can lead to development of cancer. Shirley does not have the risk factor for cancer. The children and Harry are healthy. Currently, there is no health stressor, but the family will be faced with stressor when Shirley begins treatment because the side effects of treatment could affect self-care ability. Physiological. When an individual is diagnosed with cancer, the news would affect the mental and emotional state of the person. Shirley is devastated with the news of having stomach cancer. She did not cope well with the news and therefore was referred to a mental health nurse to help her cope. The expectations and attitude towards diagnosis changes the family dynamics. There is a strong family relationship which would help in coping with the diagnosis. Continuation of human systems model to assess the family's ability to adapt. Socio-cultural. The M family is nuclear family with no other family members living with them. They are involved in the community because Harry is a pastor. Gender role is apparent because Harry is the breadwinner and Shirley is the homemaker. Each individual has a role to play to support the common good of the family. The family does not have a specific cultural practice that would interfere with receiving appropriate treatment and support. Developmental. The understanding of the cancer diagnosis and treatment modality is very important for M family because the family may not have detailed knowledge about cancer. The family's regular activities could be affected if knowledge and understanding of cancer is not clearly communicated. It is a good idea to have the mental health nurse talk to the family about it. That way, the stress and anxiety of the unknown will be minimized. Spirituality. It can give people hope and sustain them during unexpected negative life events. The family is a family of faith because Harry is a pastor. He has been serving the community for the past 15 years. He may accept the illness very well, or he may question why it happened. As a pastor, he will look up to God for help to deal with the wife's situation. The children being raised in a Christian family may be spiritually strong and know that their mother will be cured in treatment and prayers. Non-normative events. Normative life events are expected occurrences that take place as people get older. The recent health development of Shirley is a non-normative life event. Normative life events are usually related to the addition or loss of a family member, such as birth or adoption of a child, the death of a grandparent, a child moving out of the house for school, job, or marriage, according to Lancaster and Stenhope. The family of Harry and Shirley would work to adjust to the recent health development because undergoing treatment would take its toll on Shirley, which would interfere with the role she plays as a homemaker. The family would need support in meeting daily needs when Shirley starts experiencing side effects of cancer drugs. During this period, the family can employ different strategies to cope effectively. There would be need for collaboration, sharing thoughts and feelings, being open and honest, use of humor when appropriate, and the use of internet to gain more information about cancer and resources to the family, according to Lancaster and Stenhope. The family would also need social support, which can come from external family members or from the community. Stress, if not managed accordingly by M family, would predispose the family to crisis and family dysfunction. Phase of the home visit. Shirley had a hard time adjusting to being diagnosed with cancer. This can be attributed to many factors, such as limited knowledge about the disease, treatment and management, and the effects it would have on her, young family, and husband. She believed that having a healthcare professional deliver the news to her family would be better, since the provider has knowledge and will be able to educate the family on what to expect and how to cope with the situation. Nurse Tricia's home visit with the family falls into initiation and pre-visit phase. Initiation phase is when the nurse was referred to the family by the physician and includes the first contact between the nurse and the family. After the nurse was referred by the physician and the appointment was made with the family, this correlates with pre-visit. The visit provides the foundation for an effective therapeutic relationship.
Healthy People 2020 objectives. The goal for cancer treatment is to decrease the number of new cancer cases as well as illness, disability, and death caused by cancer. So the objectives is to reduce the overall cancer death rate. So some biological risks include genetics and spontaneous mutations, and as people age, they are more likely to develop cancer compared to younger people. A social risk factor would be a family's health risk increases if they are living in high crime neighborhoods, communities without adequate recreation or health resources, in communities with major noise population or chemical population, or in other high stress environments. A stressful environment such as those people experience discrimination, lack of adequate resources, and support for families affects coping mechanisms, which leads to undesirable health outcomes. An economic risk, a family health risk, increases if the family is financially challenged, and financial constraints would lead to a family living in high crime neighborhoods or in a community without adequate health resources or in a community with population pollution. Having adequate financial resources means that a family is able to purchase the necessary commodities related to health that include adequate housing, clothing, food, and education, healthcare. Healthy People 2020 objectives continue. A lifestyle risk. Living an unhealthy lifestyle has been linked to the development of many chronic diseases. Families without good health habits, such as preparing and eating balanced nutritional meals, engaging in physical activities, and supporting each other, run the risk of developing physical and mental problems. According to Lancaster and Stanhope, families maintain major responsibility for determining what food to eat, sleep pattern, family activities to partake in, and setting and monitoring norms about health and health risk behaviors. Lifestyle behaviors such as drinking and smoking can cause cancer, overweight, and obesity, which have emerged as new risk factors for developing certain cancers, including but not limited to colorectal cancer, breast cancer, uterine corpus, endometrial cancer, pancreatic cancer, and kidney cancers. Physical activity and balanced nutrition are beneficial in reducing cancer risk. Life event risk. The family is a basic unit with which health behaviors such as health values, habits, and health risk perception is developed, organization, and performed. Negative life events can affect a family's health, especially when there is no resources to help cope with the event. When a family experiences death of a spouse or a child, this event would affect family dynamics, and if not appropriate coping mechanisms is not employed, families can express setbacks that would be detrimental to physical and mental health. Health services for cancer families in need within the Cincinnati area. First, they have the Cancer Family Center, which is a nonprofit organization that helps children, adults, and families cope with cancer diagnosis. All family members are eligible for the services, which include therapeutic counseling, education, support, and hope for those affected. And in addition, the agency has 5 different programs that an individual can attend, and they are all started differently and at different times. The 5 programs being the Center for Individual and Family Counseling, Treehouse Children's Services, Coping Connection, and Waddell Family Healing Hands Program, and Camp Courage. The services are based on a sliding fee basis, but some services are free of charge or discounted. And then the Dragonfly Foundation is a foundation that is a nonprofit, and it was started in 2010. It supports families from birth to 40 years with cancer or bone marrow transplants and their families and caregivers. This foundation provides 4 different services: gifts for those involved, social events and entertainment, emotional health, awareness and support programs, and community connections. Services are started after the patient is registered and receives all the information about the foundation. All services are free of charge for patients, families, and caregivers, except there may be a parking fee when you come to the events. Health services continued for the families. There's the Cancer Support Community of the Greater Cincinnati and Northern Kentucky. It offers community-based programs and services that are intended to provide non-medical care to men, women, and children with any type or stage of cancer, and to their loved ones to support a holistic, patient-active approach to wellness. They offer programs that include support groups, healthy living, education, and social activities. These services are for anyone impacted by cancer, so the cancer patient, family, friends, caregivers, etc. And all services are free of charge. To get started, the individuals just need to choose one of the services or programs and figure out when their meeting is or the new start date to get started. Then there's the American Cancer Society Moose Camp Family Hope Lodge. The Moose Camp Family Hope Lodge is considered a home away from home. It is a place for cancer patients ages 18 and older that are able to care for themselves and families to stay when they come to the greater Cincinnati area for cancer treatment. They do have to live outside of a 40-mile radius of Cincinnati to be able to stay in this lodge. And staying here is only temporary, but it is free of cost for the patients and families. It is comfortable, clean, and the environment and a safe environment that includes 4 fully equipped kitchens, a common dining area, an exercise room, 2 TVs rooms, a theater room, and a meditation chapel, inspiration garden, a recreation room, and a great room which houses a library, guest computers, and a grand piano. It also has gas fireplaces. One last health service for families with cancer in the Cincinnati community would be the University of Cincinnati Cancer Institute. This health service is a support group service put on by the University of Cincinnati and licensed mental health professionals. There is no fee to attend the group sessions that are held at the Westchester Hospital every third Wednesday of the month. The support group is open to cancer patients and anyone who is affected by cancer, and during the group, individuals are able to share personal stories about their cancer experience in hopes of helping other individuals attending the service.
Key health problems facing families in the community include but are not limited to financial status, ability to cope in difficult circumstances, access to health care services, shops with materials that are affordable, food stores with healthy food product, transport, recreational centers and social support network. There are different types of families and they include married family, single-parent family and multi-adult household. Married family is made up traditional nuclear family, dual career family, and stepmother, stepfather family, adoptive and foster family. In a married family, financial status may be adequate to support the needs of the family that would promote health and prevent diseases. One person may be working while the other person takes care of the home. With job security in this type of family, they can afford healthy food, own a car, live in a safe community and have access to health care. In single-parent family, there may be challenges in meeting health needs of members especially if children are involved. This family consists of never married individual, widowed, divorce, joint custody and involuntary singlehood. This type of family may face struggles in providing adequate house, having access to health care, living in a less stressful community, having access to healthy balanced nutrition and so on. In a multi-adult household type of family structure, people cohabitate and share the home environment. It consists of extended families, same-sex partners, affiliated family and communes. In this type of family setting, individuals can combine resources to support each other. They can combine resources to purchase healthy food, buy a car and a house in a safe neighborhood with recreational amenities. The adults with good jobs can have access to healthcare services and children will have access to health services through various programs. The M family is a married family that would be considered traditional nuclear family. The family assumed a family traditional role where the man works outside the home and support the family financially and the woman stays home and care for the family. One member of the family is working, which means that the family can afford healthy food, reliable transportation, adequate housing, access to health care services and safe neighborhood. The family would need a support both financially and socially when the side effects of cancer treatment start taking a toll on Shirley overall health. Furthermore, we will discuss 3 articles that are related to nursing research in family health and are related to topics discussed in the class earlier this week. In the first article, Schaffer and Associates evaluated how mental and physical health correlates among family caregivers of patients with newly diagnosed incurable cancer. Researchers found that taking care of terminally ill cancer patient is physically and mentally hard on caregivers, therefore, the nursing care should be family-oriented. Furthermore, even while adjusting for other caregiver, relational, and patient factors, caregivers' mental health was found to be related to that of their loved one with cancer. Similar to concepts covered earlier this week, Schaffer and Associates defined education as a major predictor of health disparities observed in the family caregivers and general population. In the second article, Wright and Associates researched effects of family structure on adolescents' behavior. Adolescents who grew up with families with both parents, single-parent families, and families with adopted children were analyzed for presence of smoking and alcohol consumption. Researchers found out that adolescents who grew up in families with both parents are less likely to smoke, comparing to adolescents who were adopted or who were living in single-parent families. The family structure had no significant effect on drinking behavior. Nevertheless, family cohesion was an important mediator in the association between family structure and health of adolescents. Interventions and prevention programs would be most effective if directed towards the parent-adolescent relationship instead of just the family structure. This research evaluated effects of family structure on health disparities, which we discussed earlier this week. In the third article, we will discuss research performed by Da Silva, Pedrosa Lacerda, Cabral, Schneider, and Frassen, who examined breast self-examination experience among older adult women in the Family Health Unit. Statistical analysis indicated that most patients performed breast self-examination, whereas others did not perform it. Almost half patients reported that they performed breast examination when they remembered to do so, unlike other patients who did it daily or once a week. Most women were unaware of the actual period in which the examination should be performed. Even though the older adult women of the study used to perform breast self-examination, they did it on a regular basis. These women also felt more comfortable when the examination was guided by a health professional. Similar to concepts covered earlier this week, the article described educational disparities, where most of the women were lacking knowledge regarding frequency and time when the breast self-examination should be performed.